This year marks the 40th anniversary of the establishment of the Dr. Thomas A. Dooley Award. Inaugurated in 1984, the Dooley Award is conferred upon an alumnus or alumna who has exhibited outstanding service to humankind. Tonight, we recognize Dr. Richard Ott for his profound commitment to accessible health care for those in need, whether close to home in Florida or miles away in other countries. As a student at Notre Dame, Dick learned of Tom Dooley's work with the poor in Southeast Asia, and he was inspired to pursue a path in medicine. After graduating from Notre Dame in 1969, Dick earned his medical degree from the University of Florida and went to Stanford University for a 6-year-long residency in plastic surgery. It was during this time that he first made trips to places such as Mexico and Honduras to perform cleft lip and palate repairs, as well as burn scar reconstructive surgery. Not only did Dick perform these surgeries, but he and his wife, Wanda, hosted patients who required more extensive treatment in their own homes, often for months at a time. Upon completion of his residency, Dick and Wanda returned home to Florida. Just as he's starting his career as a surgeon, Dick founded a nonprofit organization then known as Interplast South, an extension of the same organization based in California. With Interplast South, teams of physicians, nurses, and other personnel donated their time and paid their own way on annual mission trips, which were coordinated by Wanda. During any one of these visits, as many as 100 patients, primarily children, had reconstructive surgery. Dick participated in dozens of surgical missions throughout his career. He once said that relief workers, whether serving in Honduras or closer to home, participate in the suffering of the world, an experience that is more meaningful than only alleviating suffering. His skills in healing and his own participation in the suffering of those in need have positively impacted thousands of lives around the globe. Dick Ott is truly a force for good. On behalf of the Notre Dame Alumni Association, please join me in welcoming and congratulating this year's winner of the Dr. Thomas A. Dooley Award, Dr. Richard Ott.
It is a great honor that you have bestowed upon me, and extremely meaningful, especially with the Interplast program, because my family was so involved in it over the years. My sister, who's sitting at the table right behind this first table here, when she was 20 years old, we asked her to go to Honduras to pick up a child and bring the child to Fort Lauderdale, because I was still a resident at the time, but had made arrangements with a hospital in Fort Lauderdale and a plastic surgeon to take care of patients on a periodic basis that we would bring over from Honduras. So she went down there, and as she told me just earlier today, they basically told her, you pick the patient. And so she chose a little girl who had severe burn scar deformities, including the problem with the poor in Honduras and in many other countries is they use kerosene for both heat and cooking and light. So they have a very high incidence of burns. But even if a child gets a relatively minor burn, they almost always get infected. And so they end up with horrible burn scar contractures. And this particular little girl, the burn scar was on her arm, and the wound healed in such a way that she couldn't extend her hand. But Cindy told me that the main reason she told that child, because there were a lot of children with deformities, was because she found out that the father and the little girl had walked for 2 days, to get to the clinic. And my wife and I were attracted to this whole idea because of to a great extent, the legacy of Tom Dooley. So when I was a student here, I would frequently spend time in the Tom Dooley room, and also every time I went to the grotto, I would read the letter that he wrote 6 weeks before he died, one day after his 34th birthday. And so I just want to show you a few things if I can. I may have to, yeah, I can see that. Okay, this is the first little boy that we had who came and stayed with us. I was still a resident, and the towhead at the top is our son Brian, who's right here at the first table. And the little baby in the front is Jennifer, who's a Notre Dame graduate. And coincidentally, which is really quite interesting, the other honoree tonight works at Hopkins. And the little boy on your right is the eldest son of the person who was not only chief of cardiac surgery at Hopkins, but he was actually president of the corporate entity that housed, if you will, corporate-wise, 2,100 Hopkins physicians. And but that was Chewy. Chewy had a deformity in the back of his neck that required neurosurgery, and so he was one of the first children that stayed with us. And the first night that he stayed with us, he wouldn't sleep in a bed because he had never slept in a bed, so he slept on the floor. And in the middle of the night, I was aware of a presence next to me, and it was Chewy standing this close to my face. So at any rate, he was one of many children that stayed with us over the years. This is a little boy with a very severe bilateral cleft lip and palate, and he stayed with my brother and sister-in-law, Paul and Therese, in Fort Lauderdale. And the reason you can see a strap mark across his face is that the mid portion of his palate was literally 90 degrees away from his face, and there was no way you could get the lip to close over that. So we hooked up this little dental device to try to bring it down so that it could be fixed. And let's see, I can't see that now. Oh, okay, that's one of our groups in Honduras. And if you'll see a young man sitting on the wall on the right, that's Pedro Dominguez. Pedro came and stayed with us actually twice, once for a couple of months. He had been hit by a truck, and it had crushed his pelvis, and it had transected his urethra. So he had to have what's called the suprapubic catheter, and he kept getting urinary tract infections, and he stopped growing, he wasn't thriving. And so when he first came to Florida, we made arrangements to have him have surgery, very specialized surgery at the University of Florida in Gainesville, but unfortunately the surgery didn't work. And so he went back to Honduras for a little while, and then he came back and stayed with us for well over a year. And our son Brian, when he wrote his essay for college, he wrote it about, the experience of having a brother. And our daughter's in that photograph as well. Both Brian and Jennifer would go on trips with us to Honduras. And there were many children that were brought back. They didn't all stay with us by any means. We had volunteer foster families that would volunteer their homes, and they would take care of these children. And one of them was from an orphanage and ended up adopting one of the children. So I mentioned the fact that Tom Dooley's legacy had a great impact on me. I can't read what's underneath there. Can you hear me okay?
Yes.
Okay. The experiences of Honduras and the experiences that we had after Hurricane Andrew made it extremely clear to me that that we talk about service, but actually the people who go on these trips benefit more from the experience. And they benefit from it because they are truly participating in the suffering of these people. After Hurricane Andrew, we had a doctor who said that his experience in Homestead after that hurricane was more meaningful to him than anything he had done in his private practice since he had graduated from med school. And I think it's one of those things where it's this issue of being involved in something that's bigger than yourself. And that creates a totally different experience. And Tom Dooley, I think, here, I don't know how many of you know the history of Tom Dooley, but the bottom line is that he wasn't a very serious student at Notre Dame, wasn't a very serious student in med school and all this, but he was so impacted by what he saw in Vietnam that he started bringing in other doctors and nurses and setting up all these hospitals. Here he is with the local people at one of his clinics. So for me, when I decided that I was going to go into medicine, when I wasn't 100% sure, I got a job at a hospital in Fort Lauderdale, and I ended up working in the OR as a scrub tech, as a pre-med student while I was here at Notre Dame. So that was my summer job. And the first time I saw a plastic surgeon fix a cleft lip, I was hooked. Because you take what's a really pretty bad deformity, and you end up with a fairly normal looking lip. And then of course, that child also had a palate. And so one of the other issues that you experience is this issue that, and this is actually a quote from Joseph Campbell. Joseph Campbell said, what people are really looking for in life are experiences of feeling alive. Well, when you're participating in these programs, you feel alive. Medicine is gradually becoming more and more bureaucratic, and there's all kinds of problems that everybody's aware of, I'm sure. But the point is that that kind of practicing medicine doesn't make you feel alive. And so, and one of the reasons I think is that on these trips and down in Homestead, which went on for many, many weeks, because everybody's a volunteer, you've created a horizontal structure. We usually take over rooms, and everybody's working in the same room. You're working with your fellow caregivers. You're working with the patients. And what happens is instead of it creating burnout, I'm sure a lot of you have read in the paper about the fact that more and more people in medicine are experiencing burnout. These programs energize people, because the first ones that volunteer for the next trip are the ones that went on the last trip. And so this sense of an interconnected presence, you're connected with your fellow workers and you're connected with the patient. And I think I see it as an experience of non-duality, in the sense that you don't feel this separation anxiety that you get in a more vertically oriented system, where it's a hierarchical system. There's an administrator, there's the doctor, there's the nurse. But there, everybody's a volunteer, so we're all kind of working for the same goal and with the same interest. The point of this is that it's a hard thing to articulate. And it's because the best things can't be told and the second best are misunderstood. So a lot of the experiences are ineffable. And I've had doctors over the years say to me, well, why do you go down there? Why do you do that? That's kind of crazy. There's no air conditioning. You might get, the water. You shouldn't drink the water. And you just have to tell them, I can't explain understand it unless you experience it. And so it's the same idea here. The best things can't be told, but the best things can be experienced. And that sense of, it's almost a sense of oneness, or as some would say, a sense of non-duality with your fellow workers, your fellow in this case, healthcare workers. And so this is, again, you know, the first time I went down to, actually the first trip I went on was in Mexicali. And the overall impression was, in the United States, we don't understand poverty. Poverty here means your car's kind of old, and maybe you only have one color television set. This is where you see poverty. So two children in each bed in the hospital in Honduras. We would bring all the equipment with us down to Honduras or Mexico or wherever until 9/11. And I was in Venezuela for 2 weeks right before 9/11. I came back. The equipment was supposed to come back the next day. Well, after 9/11, you couldn't get your equipment back. So what we ended up doing is, on the next trip into Honduras, we left the equipment there, and so that eliminated that problem. And in San Pedro Sula, there's one operating room has 2 beds, and everything you see there, all the gowns and all the equipment came from South Florida. And this is a room with a single operating table. And just another example. Everybody in this group, though, are people who've been on many trips. The gentleman on the immediate left, he started a program similar to ours in West Virginia. He was a fellow resident of mine. Because what happened was the original idea for Interclass was started at Stanford University by the chief of the service, when in 1969, a boy with a 10-year-old with a cleft lip and palate was brought up, and he had surgery at Stanford, brought us, and the doctors realized that we weren't just fixing a deformity, we were rehabilitating their life, because these children can't go to school with these deformities. And so here's just an example again. This is the other thing is that cleft lips and palates, as a general rule, are worse in poor countries. It's not only that the deformity is more common, but they're worse. And the reason is because these types of deformities are both genetically involved, but also environmental. It's environmental as well. So with poor nutrition and various other environmental factors, we see worse defects. And here's a child again, not long after surgery. And so this is what I was making this point about being involved in a horizontally oriented experience versus a vertically one like we have today. The other point that when people have asked me over the years in Fort Lauderdale, well, what hospital do you think is the best hospital? My response always was, depends who your doctor is, depends who your nurse is. It's not the building. And so, for me, when I think of Notre Dame, I think of people. And for me, it was Tom Dooley and Father John Dunn. When I took his course as a senior, his course had such an impact on me that I seriously considered not going to med school. I seriously considered, pausing, and I actually asked Father Dunn, "Can I take you out to dinner?" And he asked me a bunch of questions. He said, "No, I think you're supposed to go to med school." But if he said, "No, go to the Peace Corps," I would have done it. And so he's had such an impact on me my senior year that when Wanda and I got married at Notre Dame here in the Basilica, it was John Dunn that officiated. And then, you go off to med school, you're starting a practice. We lost contact with John Dunn. And then in the late 80s, well, let me back up just slightly. The only notes I kept from Notre Dame in med school were the notes from John Dunn's class. Only one. And so in the late 80s, you may remember when Joseph Campbell was doing all these interviews with Bill Moyer, and I was listening to them, and I thought to myself, wait a minute, this sounds like what John Donne talked about. So I pulled out my notes. And in one of his books, he talks about how in one of his travels, he met someone who couldn't understand, in their culture, they couldn't understand why a man his age didn't have children. And his response was, well, I have thousands of children, because I think he taught more Notre Dame students than anybody else. And so I called him on the phone around in the late 80s and said, this is one of your children. And here's this was our 25th wedding anniversary, and we're in the log cabin for he blessed our marriage. And then this is again, we stayed in contact with them. And when Jennifer got into Notre Dame, I said to her, I only have one piece of advice. Don't leave Notre Dame without taking John Donne's course. And they ended up becoming very close because as John Donne got older, he had more sabbatical time, and the priests here have a home in the Oakland Hills, and he was out there a lot, and Jennifer and her husband had a restaurant in Berkeley, so they stayed very close. This is I did not know that this was one of John Donne's favorite quotes, because I'm to me, Michael Polanyi is a hero. But he actually, in his last book, he actually starts the book with this quote from Michael Polanyi. And it's this idea, it's sort of like the same thing I was saying earlier, that you go on these trips, you have these experiences, and other people, they're ineffable. There's no way for you to explain to people why you would do this kind of thing. You know, we talk about service. That's sort of an I-it relationship. You know, it's not because people don't do these things because they say, well, I think it's the right thing to do, or I want to give back. It's because of the experiential feedback. It's because it makes you feel alive. It gives you more energy rather than draining you. So, and you know, J.R.R. Tolkien and Paulo Coelho, you know, he wrote The Alchemist, and Tolkien, of course, was Lord of the Rings. And John Donne would read Tolkien. He'd read all the Lord of the Rings, and then he would start reading it again. And that's because this was his big message. And I know that as he got older, and in the books he wrote later, he talked about this a lot more. And it's this idea that if you pay attention to what is really going on in your life, you'll find out that these are the things that are critical. And he talked about this a lot. Things are meant, there are signs, the heart speaks, there is a way. And this just shows you some of the books. Someone asked him, this is in his handwriting, John Donne's handwriting, and you'll see, I only saw this recently actually, but if you see, where is it? Michael Polanyi, The Tacit Dimension. Here he wrote it as, we can know more than we can tell. And so I was fascinated that there was that connection. And Karl Rahner is a well-known theologian, and this is not really a direct quote, but it's my understanding of what he believed and that I know John Donne did, and that is that the true Christian of the future will be the one who has experienced something. You know, I think John Donne was a mystic. I really do. I think he had experiences, spiritual experiences that were, and then I think he wrote all his books and he taught because it's ineffable, he still wanted to guide people as to how the potential was for them to have similar experiences. So people who have experienced something and who live by the insights gained rather than propositions or arguments. And there's a story that he had a very bright student who would argue with him a lot. And one day he got a little upset with the student. He said, don't live your life by arguments or propositions. Live your life by insights. Taking into this account of of this idea of things are meant, pay attention to what's happening in your life. For me, 1996 was a seminal, unbelievable year, because in the very early part of the year, in a rather serendipitous way, Wanda and I were invited to go to a reception honoring Edgar Mitchell's anniversary of his 25th walk on the moon. And I don't know how many of you know the story about Edgar Mitchell, but he's the one that when he was coming back from the moon, he had this profound luminous experience of this feeling totally connected with everything in the universe. And some of the other astronauts had that as well. They had a similar experience, but it totally changed his life. And so he left NASA and he went on to found the Institute for Noetic Sciences, or of Noetic Sciences. And so he spent the rest of his life trying to understand what had happened to him on the return flight from the moon. And so we became friends. And it was interesting to, over many, many times of having him over for dinner, of us going over to his home for dinner, he had a perspective that resonated with this idea of that things are meant to happen in our lives if we just pay attention to them. And so I'm just going to conclude this on the list of John Dunn's list of books that he recommended to his students. This is just a little part of the ninth Duino elegy by Rilke, and just to read it to you briefly, or that brief portion of it, I should say. He says, Rilke says, but because truly being here is so much, because everything here apparently needs us, this fleeting world, which in some strange way keeps calling to us, the most fleeting of all. Once for each thing, just once, no more. And we too, just once. We only get one life. And never again. But to have been this once, and I think this includes experiences, completely, even if only once, to have been one with the world seems beyond undoing. And I really believe that Tom Dooley and John Donne understood that. And I think that for me, when I think of Notre Dame, these are the two people that certainly have the most impact on my life. So I thank you all for listening, and I do very much appreciate this award that I will cherish.